Hello everybody, today we're going to be going over brushing and flossing and how to demonstrate it visually to an uninformed patient who may need some help. Our key points are going to be, we're going to go over frequency, bristle types, toothpastes, we're going to go over how to hold a toothbrush, the Bass method, and of course flossing, why is flossing important, the C&U method, and also how people ineffectively floss. So we can get straight into frequency. So people usually like the guideline is you want to brush twice a day and you want to brush for at least 2 minutes. So you want to brush in the morning and at night. And after you brush at night, you don't want to eat anything else. As far as bristle types, you want to aim for a soft to medium bristle. You don't want a hard bristle to cause too much sensitivity to your gums. And toothpaste, you want to look at a toothpaste that has low abrasion, because every single day you're going to be brushing your teeth twice a day, every single day, and you don't want to wear down that enamel by doing this motion every single day because it has too much abrasion. So as far as holding a toothbrush, it's fairly simple, but we'll go over it. So it has like a little curve right here. So honestly, it's just any way that's comfortable for you. Usually I just put my thumb right here and I just grab it like that and brush. Like some people have different ways of holding it, but I would say this is the standard way to hold it. So as far as like if you have complications with something like arthritis, this toothbrush is going to be too slim for you. You're going to want to have something bigger and bulkier at the bottom because you have grasping issues. So you're going to want to know your patient and their complications. So the Bass method is probably the most effective method that there is for brushing your teeth. So what you want to do is you want to hold your toothbrush at a 45-degree angle. So this is how people usually hold their toothbrush, and they just go back and forth or up and down like that. That's a 90-degree angle. That's ineffective. You're only getting supragingival stimulation, which basically means you're just cleaning the tooth surface above this gum line right here. So you're just cleaning this part, just like that. So that's ineffective. What we want to do is take that 90-degree angle and we want to tilt it to a 45-degree angle, just like this. So I'll go ahead and give you a better view. So this is the wrong way to do it, at the 90-degree angle. So you're going to want to tilt that at a 45-degree angle. And then we're just going to want to get the outer surfaces near the lip. And we're just going to want to jiggle a little bit, just like that. It's not something this crazy. You just want to do little tiny jiggles, and we're trying to simulate an electric toothbrush. So you want to do something just like that. Very minimal. So once you do that for all the surfaces on your lip, including on your bottom jaw and your top jaw, you want to go to the lingual side. So still with that 90-degree angle, you want to do the same little tiny circular and vertical motions, kind of like you're jiggling it. And once you get to the anteriors, you can still do it at the 45-degree angle, but a lot of people hold their toothbrush vertically and they just clean from the gum line all the way to the top of the tooth surface, which is fine as well. And you're going to want to do that for the top surface as well, more like that. So that's the Bass method. So the key points there, just holding it at a 45-degree angle instead of like this at a 90-degree angle. So now that you kind of have a general understanding of brushing effectively, we're going to go over to flossing. So for flossing, you're going to want to know the floss type that you want. Generally speaking, people use just a wax floss. That's the most popular. So you want to get about 1 to 2 feet of floss, and you want to wind it up on your middle fingers on your non-dominant hand. Not too tight. You don't want to cut off blood circulation. And then you want to wind it up maybe a couple of times on your dominant hand. And then you want to use these fingers right here as a guideline to hold it whenever you're going in between your teeth. So I'll go ahead and give y'all a better view of this. Okay. So again, so these are, you're using your forefingers and your thumbs as your guideline to floss. And what you're going to do is you're going to get in between the interdental papilla, which is basically this little triangle of gum. So what you're not going to do is go straight down and hit that gum. You don't want to do that. You want to go on the right side and the left side of that gum, because you don't want to be tearing up your gums like that. So we'll go over that on ineffective ways to floss. So again, what you're going to want to do is go on the left side of that tooth surface, and you're going to do a C. So it's kind of like a C this way and that way. So you're doing a C like that, and then you're doing a C like that. If you can see that. And then you're just going to go up and down on that tooth surface on both sides. Sorry about that, my dog's going crazy. So you're going to go up and down the tooth surface on both sides, just like that. And when the ineffective way people usually do that, like when they floss, the ineffective way, they go like this. Just go straight down into that papilla, and they're just tearing up their gums. So you don't want to do that. You want to go around the tooth surface, and you want to hug it and just go up and down, just like that. And you want to do that on all tooth surfaces, from the bottom jaw and the top jaw. Okay, so now we've got a good understanding of both brushing and flossing. So that's my demonstration today on how to brush and floss. I hope y'all learned something that you can take with you into clinicals, and thank y'all for your time.